Hi, my name is Dr. Mikityansky and I'm a board-certified gastroenterologist and hepatologist working with Triborough GI in the Triborough, Brooklyn, Sheepshead Bay area. Today what I'd like to talk to you about is inflammatory bowel disease. Now, what is inflammatory bowel disease? Many people know it as simply Crohn's disease or ulcerative colitis, and that's correct because those two terms are actually under the umbrella of inflammatory bowel disease. Now, there may be not a lot of understanding as to what inflammatory bowel disease is, and oftentimes it's confused with irritable bowel syndrome or IBS. However, they are distinct, different entities. Now, what are the symptoms of inflammatory bowel disease? Inflammatory bowel disease can present in young people as well as older people. It's got a bimodal distribution, and the symptoms can be abdominal pain, blood in the stool, fever, diarrhea. Those are all very common symptoms for many complaints that we get in the office. So it's very important that if you have any of these symptoms that you follow up and see a gastroenterology specialist, because this disease actually has to be diagnosed by a gastroenterologist. Making the diagnosis of Crohn's disease or ulcerative colitis is of utmost importance for us because it really changes the management of our patients. Reason being is that Crohn's disease and ulcerative colitis actually increase your risk of having colorectal cancer sometime in the future. So when we make the diagnosis, we enroll the patients into a very aggressive and appropriate screening and surveillance program with colonoscopy to make sure that we keep you in the best of health and that you don't develop colorectal cancer in the future. So inflammatory bowel disease can actually run in the family. So oftentimes when we talk to patients that come in presenting with these complaints, what we'll do is we'll ask if anyone in your family, like a loved one, a parent, or a sibling, has ever been diagnosed with something called colitis. And if that's so, your symptoms may be even more worthwhile checking into to make sure that you are also not having Crohn's disease or ulcerative colitis. If you find value in this video and you'd like to share it with your friends and family, that would be great. If you have any further questions and you want to schedule a consultation with one of our gastroenterologists, please don't hesitate to give our office a call.